Some people might be only diagnosed when they show up to the hospital, when they've got an unexpected vaginal bleed in their pregnancy. Some people will be diagnosed even without any symptoms. So they'll come for maybe their routine anomaly scan, the big scan that people have in the middle of pregnancy, and the sonographer might see that the placenta is low and the sonographer might have some concerns, and at that point they might be referred in to see a fetal medicine doctor who would scan in more detail to make the diagnosis. Now, it's not always possible to be fully sure on ultrasound that it is actually a placenta accreta spectrum. We only really know that at the time of delivery, but there's lots of signs that we might see on the ultrasound that would make us, I suppose, suspicious that there's a problem. There are definitely benefits to doing a tummy scan or a transabdominal scan, and benefits to doing the internal scan, which is the transvaginal scan. On the tummy scan, we get to look at your baby, get to see how your baby is growing, how the fluid is, and we get a sense of where the placenta is generally and what it looks like. But when we do that internal or that transvaginal scan, we get to see much more fine detail about what the placenta actually looks like, what the relationship between the placenta and the neck of the womb or the cervix is. So it's a very useful scan for us to have the internal component as well. Ultrasound has been shown to be very, very safe in pregnancy, both for you and your baby. Both external or tummy scanning and internal scanning are safe and appropriate to do in pregnancy. Sometimes we prefer not to do internal scans if there's active bleeding, but in all other cases we're very happy to do it because it's very safe. So when you come for an ultrasound in pregnancy, you should come with a full bladder. We can see lots more in early pregnancy when your bladder is nice and full. However, as your pregnancy progresses on, we can often see more, and especially with internal scans if your bladder is empty. So I would say come for your scan with a full bladder, but we might ask you to empty it depending on what we want to look at.